tower alone on the sea. You became the light on the dark side of me.
Populations with Special Health Needs, Part 3, by Professor Tammy. Mental health. Mental illnesses rank second after ischemic heart disease. Risk factors for death from suicide, cardiovascular disease, and cancer. And mental health doesn't only affect adults, it also affects children. Most mental health services are provided in the general medical sector rather than through formal mental health specialist services, which makes sense. Your general doctor, your family doctor sees you and can check in on how you are not only physically but mentally and emotionally, and can provide recommendations. The nation's mental health system is composed of two subsystems, one primarily for individuals with health insurance coverage or private funds, and one for those without private means of coverage. Chronic illness disability. Chronic conditions are characterized by persistent and recurring health consequences lasting over a long period, which is generally irreversible, so you can't go back. So remember, chronic is continuous. Chronic illness and disability pose unique challenges to a healthcare system that is primarily oriented toward treating acute illness. That means very severe illness. A significant number of deaths are attributable to preventing chronic conditions. The U.S. healthcare system is primarily oriented toward treating acute illnesses versus preventive or illnesses. So U.S. healthcare system, we tend to focus more on curative. Like we wait till people get sick and we try to cure them. HIV/AIDS is an acquired immunodeficiency syndrome, AIDS, is associated with the human immunodeficiency virus, HIV. HIV is a retrovirus that causes immune system suppression leading to AIDS. Many public health experts believe that cases of AIDS are still underreported. The reason for such underreporting include poor reporting standards in U.S. health departments, patients, and denial of the risk factors that are likely to transmit HIV. So just to let you know how this all works, if your doctor finds out someone has HIV, they have to report to the local health department. So that's the rules. That way the health department keeps the statistics and understand what's going on in the community. Other HIV problems in the United States include issues of urban home health care, HIV infections in rural communities, children and women, lack of HIV prevention programs, there's discrimination, the need for more HIV/AIDS related research, and healthcare provider training. Because sometimes maybe someone might have a personal belief, a healthcare worker might have a personal belief, and sometimes that might not reflect how they were trained. But it's really important to be more open-minded about how we treat those with HIV and how we help prevent it from spreading. See you soon. Remember to read the book.